research, but less for innovation. So as our governments and our ministers are online, I request that we have additional grants. And I'm glad that the Biomics program has started. We look forward to having prototype development grants, seed innovation grants, innovation challenge funds, and supporting pilot manufacturing, supporting intellectual property strategies, supporting implementation testing, supporting clinical validation, and so on and so forth. Thank you very much for giving me the opportunity to speak at this webinar. Back to you, Ajay.
Pauline, thank you. Thank you so much for mentioning all of that. And I'd also like to thank Daudi and Ken for their comments. I think we are on time with regards to the panel. I also want, because of all the conversation that we have had and the points that were discussed, I just want to make a mention here. I'm going out of line over here, but Brian Bigirwa, who I see on the screen prominently throughout this panel discussion from Brentech, I think they are a classic example of a Ugandan vaccine manufacturer who also is not just playing in one market, but in the region they have a fair share of the market that they are in the animal vaccine domain. And we have been fortunate to work closely with Brian through a couple of programs that we have run in Uganda over the years. So just wanted to give a shout out. And if there are entrepreneurs in the room, I think you should just text Brian, who has been at it for a while, for better part of last 15 years, which is, and I think everything that we spoke about during the panel, whether it is research to commercialization, whether it is regulatory and compliance, whether it is fundraising, whether it is market development, I think Brian, as an entrepreneur, taking a research product to market would have undergone a lot of those. So good guy to give a shout out to if you're an entrepreneur and early on in your journey. With that, I'd like to close the panel. But at the same time, I've also made a note of a lot of questions that are there in the chat window. So between Jagruti and I, we have copied that, and we'll take time to kind of respond to questions, because we are pretty much running on time on the webinar. I'm handing it back over to you, Jagruti, now.
Thank you to our panelists for the wonderful discussion. It was great hearing insights, and that also encouraged a lot of questions to come in the chat, but also the attendance that you see has been constant. That means that it has been an interesting conversation. Like Ajay mentioned, it won't be possible to take all questions given the time, but I'd like to invite Brenda, from Pathogen Economy, STI, to give remarks, as she's been very supportive of the program, and she has been on top of everything that is happening here, and she's ensured that this takes off with our first webinar kicking off today. So I'd like to invite her on screen to share some remarks about the program and the initiative.
Thank you very much. This is Brenda, the honorable ministers, the leaders at Biomics, and all the distinguished ladies and gentlemen. That's my face. My name is Brenda Nakazibwe. I am the team lead of the Pathogen Economy at the Science, Technology and Innovation Secretariat. The Honorable Minister for Science and Technology, Honorable Asimwe, we welcome you. Honorable Dr. Msenero, we thank you so much for your visionary leadership. Biomics actually comes in, it's a dream come true for the work we started out at the Pathogen Economy. We remember, and with the team members that are here, with our think tank lead, Professor Daudi Kavasa, the professors that have just spoken, Professor Chirenga, Professor Pauline Biachika, my teammates, Amanda, Ipola, Abel Walekwa, right here at the Pathogen Economy, Leah Nabidie, as we worked out building the Pathogen Economy, the word economy is now coming to light actually through the biomics. Yes, we've already had some gains where we've been able to save the country importation hemorrhage through the PCR, where we've saved the country over 148 billion Uganda shillings. We are looking at Jenna Herbals of Covidex and many others that have been able to sell and saved the country hemorrhage. And Microhim Scientifics working on diagnostics for malaria, for HIV, for sickle cell anemia. Great strides. And as we move on, Biomics comes now to also further strengthen the economy bit of the pathogens. Now, Jagruti and Ajay, and thank you so much for supporting us through that process, and Dr. Winters as we worked. You notice and we know that our friends that are not from Africa have known the power, have known what pathogens mean. So the samples, the data that we collect is gold to them. So with the leadership of His Excellency the President and now Dr. Msenero, we worked out saying we should step in this space. And to the incoming minister and ladies and gentlemen that have joined us for this webinar, thank you. We have noted that Uganda is taking lead. Last year, we hosted 17 African countries in conjunction with Africa Centers for Disease Control, Africa CDC. And the countries from the Ugandan story said they do not have anything like this in their country, in their countries. They do not have science and technology being funded by their African governments. And so looking at the strides we have taken, this is great. So beyond the science and technology, we are now saying we are driving these products to the market. And the bottlenecks have been named. And I just only want to say that we have been able to also set strategies to work on the bottlenecks. For example, for the clinical trials. Professor Byachika here, Professor Chirenga, lead our clinical trials platform. For the very first time in the country, did we do clinical trials of our own products right here in country. We've long evaluated other people's products, but now here we are, and a whole platform that is very resource efficient and effective has been set up. And in all this, we are chasing the economy to ensure we are developing human capacity, but also we are pushing our products out and much faster. We supported National Drug Authority in a consultancy to review their guidelines for clinical trials. And honorable ministers and ladies and gentlemen on this call, NDA told us that actually that was the very first time, because of the work our clinical trial team led, the work that CONAT started, because of that, that was the first set of guidelines they set up as our national regulator, the National Drug Authority. So there's quite a lot of firsts that have begun out of the work at Science and Technology led by the Honorable Minister, Dr. Msenero, and particularly in this case for the pathogen economy. Intellectual property, we've been able to register even at the World Intellectual Property. One of the products, Honorable Minister Asimwe, you'll hear of it, Pombegard. It has already registered at the World Intellectual Property. It's a natural therapeutic, but it has leaped that far to be, and value has been added to that product. And then when we look at human capital, from all the 56 grants that are under the pathogen economy that we coordinate and supervise, all of them, we emphasize that they should have master's students and PhD students. And right now we can count over 300 students in this time space of about 5 years. That is remarkable. It's been publish or perish, like the earlier speakers have said. But now a PhD student, a master's student is working on a product, is working on a vaccine. Their name is being added onto that patent. That is huge for the country. So, and as I end, we indeed rode on the shoulders of giants, like we scholars say through Google Scholar. That is their slogan, standing on the shoulders of giants. We found institutions. We cannot say we started from zero, but they were not in this line of driving products to commercialization. And some of the institutions were actually not working on products, but standing on the infrastructure, standing on the human resource they had, standing on the willingness to actually drive the pathogen economy. We additionally set up infrastructure with them. We did studies, we collaborated, and lo and behold, here we are with some of them being pilot manufacturing plants for the country. So we stood on those shoulders, and now, like Professor Kabasa has said, we are driving accreditation so that all the work that is being done there is actually, the data there is trusted. So as I end on this, we broke the silos. We put institutions together, and that's one of the things that has made us stand strong and stand tall. Because without institutions working together, you'll miss out on the expertise in Barra University. You'll miss out on the expertise at JCRC. I saw the ED of JCRC, Dr. Chitio. We are glad to have you, Dr. Sisi Chitio. We shall miss out on the indigenous scientists, the ones we call herbalists. So all these put together and institutions working together is one of the things we have seen. The other time it was my science, institution A, institution B. This is our research project, because the funding was not coming from there. And if the collaborator was institution A, that was it. But these are government funds where we have broken those silos. We built networks. We have produced high-level products. The first human vaccines for the country have come out of this work of 5 years. So what a journey it's been. And now with this program, the Biomics Lab, dealing with the bottlenecks, IP, learning from India, where our consultants are coming from, things of regulation, how do we go around these corners? We know we are going to go far. So more of our diagnostic kits are going onto the market, more of our medicines, more of our vaccines, more of our medical equipment. And already for all of these, we can say we have, at least for each of these fields, we can say we have between 10 and 20 products, depending. The human vaccines have fewer, but for the rest of the products, we have much more. So what a joy, what a blessing to be able to set this up to drive the structure of our science and technology from end to end in the pathogen economy. And back to our moderator tonight. Thank you very much for this opportunity. We are glad to be working together. And at STI, we say, making Uganda the best for God and my country. Thank you.
Thank you so much, Brenda. With that, we'll conclude today's session. Once again, those who joined late, I have put the link to the website that you can go through. But after the session, tomorrow we'll be sending the recording link so that you can share it in your network, as well as the website link to all the registered attendees. to ensure that you have access to the recording, but also the link to the website. Please note that the application deadline is 5th of June. So we encourage you to take weekend to apply to the program and ensure that you submit your application before the deadline. Once again, I would like to thank everyone who joined today, our honorable ministers, the secretariat team, the panelists, and the organizers. Thank you once again and have a very good evening. We look forward to the successful program and follow our LinkedIn pages to keep yourselves posted on what's happening with the program. Once again, thank you so much and have a good evening.
Thank you. Have a good evening too. Thank you.